Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. VA budget shortfalls lead to pause of some healthcare hiring. Now, obviously, there's going to be collateral effects to that because if they're not hiring more and they're already slipping back, and then burnout continues, and then more people leave, and then your appointments get pushed back even further. So I did find this actually today. The article is from January 31st. But I'm sharing with you today and wanted to jump into it. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. It helps out a lot. If you want to become a member, you can do so by going to the home page. You will see the member section and then you will see a join button. That helps me to find you quicker in the comments and it really does support the channel. So thank you so much to all you members. I really do appreciate each and every one of you. All right, so let's jump into it here. The Veterans Affairs Department is limiting hiring in some parts of its healthcare staff, according to several employees throughout the country briefed on the matter, marking a stark departure from the record onboarding VA accomplished just last year. And again, I'm going to throw this out there. When it comes to, look, you could slice and dice numbers, right? So sure, you hired a lot, but how many left? You need to look at the net, not the total hiring, right? What's your employee count net look like with your attrition? Anyway, so let's move on. The department is facing budget shortfalls as costs rise and its funding has not. According to the workers and internal documents obtained by Government Executive, which is the website that I'm reading this from, Government Executive, forcing it to take cost-cutting measures. Many medical center directors are not currently permitted to add staff and, in at least some cases, cannot backfill vacancies with external hires. That's always not good. All right, so when you can't backfill a vacancy with a new hire, that's kind of like a double whammy. So if you have 10 employees and you lose one, now you have 9, but they won't let you fill that one with an external, so you have to fill it from an internal. You still have 9, so that sucks. All right, so that's a horrible nugget that we just read. All right, moving on. VA oversaw remarkable staffing growth in fiscal 2023 as it prepared for an influx of patients newly eligible for care under the PACT Act. Officials previously said they exceeded their ambitious hiring goals, meaning their healthcare facilities would mostly focus on maintaining their existing staffing levels. And again, this is primarily focused, actually I think it's all the way focused, on VHA, which is the Veterans Healthcare Administration, not the VBA. So what's funny is that sometimes in these things, they'll give data for all of VA, and then they'll focus again on data just from VHA, and then they'll go back to all VA. And so it's a little bit hard to follow if you're trying to keep up with, I don't know, the little more minute detail. Anyway, moving on. Officials previously said they exceeded their ambitious hiring goals, meaning their healthcare facilities would mostly focus on maintaining their existing staffing levels while growing only in certain fields. The latest directives at the field level, however, go beyond that in actually instituting hiring caps in part of the workforce. At one medical center in Arkansas, officials noted in a slideshow they were implementing cost avoidance strategies that included strategic hiring, onboarding, overtime reductions, travel limitations, and other efforts. Here's the nugget there. So from the before part of maybe hiring caps, right? So now there's hiring caps. You can't fill from external, so you got to fill from internal. You still have 9, right? And overtime reductions. All this points to extended wait times for who? You. And if you remember back when, I can't remember if it was Sharif Ellenhall or not, but somebody higher up in the VA was basically stating to the VHA employees, hey, look, let's not really try to hand out community care right? Let that be the very last resource. Let the veterans really be in pain before you allow them to do that. Let's try to keep them internal, right? Which, I guess from their perspective, I'm looking at it from kind of a self-preservation standpoint. Look, if you want the VA and your job to stay in existence, you need to have patience. So they're trying to keep you there and not go outwards, because then what's the purpose of their existence? So all of this is just leading up to not looking very good. So let's move back on here. The facility, part of regional area, a veteran integrated service network, or VISN, VISN, that includes, which there's, I can't remember how many, 5 or 8 or something of them throughout the U.S. They're kind of big. So that includes parts of Arkansas, Florida, Louisiana, Mississippi, Missouri, and Texas. Projected a $14 million budget shortfall. Oh my gosh. I didn't actually get to that part when I skimmed through this before sharing it with you. $14 million budget shortfall for fiscal 2024. And said that based on our fiscal year 24 allocation, we cannot support existing full-time equivalent levels, nor can we afford current active recruitments. Poor management forecasting and all of those things. I mean, this is the upper level. Look, when it's when you're in the government, right? It's here's your money. Be a fiscal steward. Run your shop, right? And it is what it is. You shouldn't have this sort of an issue sneak up on you. So let's move on. Positions with firm offers would be pushed through, and vacancies filled internally would be permitted according to the presentation. But external backfills would require special approval and a strategic onboarding date. It went on to say that the facility was anticipating it would decrease full-time employees, FTE, through attrition. Wow. So basically, between burnout and just the natural attrition of people leaving for better jobs or moving or whatever it is, they're just going to go, okay, look, we automatically have, I think of employees for these big organizations as, they're a bucket with holes, right? And so it's just constantly draining out. So that's why you're constantly recruiting and pouring more sand in the bucket, and then the sand drips out, right? So they're not trying to plug any of these holes. They're like, let those holes drain out the sand. Which, how good is this going to be for you, the end user, right? This is horrible for us, all right? Though, moving on, though it would avoid eliminating currently staffed positions. Sure. A Colorado-based employee noted their supervisor was told 2 weeks ago to freeze hiring, though job postings already open could be filled. No further full-time positions would be filled, the employee was told. In its internal communication, I like this website. The VA facility said mental health, access to patient safety would not be impacted by the change. The office said it could not currently afford about 80 of its roughly 2,300 employees. 80 is a big number, because 2,300 is not that big. I'm just saying. Another individual familiar with the new policy said medical centers cannot increase their employee headcounts, with VA Undersecretary for Health, Sharif Ellen Hall, saying earlier this month that the VA is targeting staffing growth in mental health, cardiology, and gastroenterology. That could require staffing cuts elsewhere within the department. One employee said they were told the budget situation is creating a national problem. Because even if it's in a VISN, right? The VISNs all fall into your VHA, and ultimately the VHA could then say, okay, look, we need to pool now resources from this VISN over here to this one to help this one, right? So now you have two that suck. They just don't suck as bad as they would have sucked. The one, right? All right. So let's move on in this. Oh, geez. One employee said to create a national problem that will be addressed VISN by VISN. Applicants in the hiring pipeline, but without a final offer, will see that process terminated, the employee was told. And that sucks too, right? Think you have a job, you've been working on the whole process for 6 months because it moves very slow, and finally you think you're at the tail end, and bam, terminated. We are constantly communicating with the local VA leaders to make sure that we have the staff we need to best serve our nation's veterans, said Terrence Hayes, the VA spokesperson. As such, leaders are empowered to make these decisions at the local level about their ongoing hiring actions. The VA secretary told reporters on Tuesday the Veterans Health Administration would focus on targeted hiring in fiscal 2024 and ensuring its existing staff, which grew by 7% in fiscal 2023, is seeing more patients. Where we continue to see the need to hire, we will make sure that we have the resources, the secretary said. He cautioned, however, the VA resources are planning have been impacted by the lengthy continuing resolution that is currently funding government and fiscal 2024 budget deal that will keep domestic funding mostly flat. As it relates to VHA, there may be times when we determine that there are personnel that we don't need going forward, the secretary said. Wow. So now you got people on chopping block too. And I think that they're just fingers crossed on the natural attrition. Maybe people will see the writing on the wall and jump ship. Hayes stressed that the VA is strategically hiring in several key areas and is focused on ensuring the availability of its staff to meet veterans where they are. The department is currently opening night and weekend clinics to boost appointments for some specialties. But remember, they're trying to draw back on overtime, in which wait times have grown or stayed stagnant despite hiring. VHA added a record 61,000 employees in fiscal year 2023 and saw its fastest growth rate in 15 years. It has set aggressive hiring goals, which far outpaced, while also decreasing employee turnover by 20%. The dramatic about face is both a reflection of that success and a potential warning sign for other agencies throughout the government that will similarly, close enough, be dealing with frozen or shrinking budgets and rising costs, including a 5.2% across the board pay raise for federal workers. Pretty funny that they get the 5.2 and we all got stuck with our COLA. VHA has still managed to start fiscal year 2024 with continued staffing growth. It brought on 15,000 employees between October 1st and December 31st, an all-time high for that period, and grew the workforce by an additional 2%. VA employees said the new policies went into effect in January. So with that, we'll conclude it there. Yeah, you know, it is what it is, but not very excited about that. So we'll see what happens and what the end result is. I'd love to see your comments. Have a great one, and remember, if we don't take care of each other, something went wrong.